and welcome to the MIMIT Health Live Life Fibroids Free Health Talk. I'm Sandra Robinson Cunningham, and I'll be your host for this evening. And today we have a powerful 1 hour packed with information, Q&A, details, as well as testimonials. There'll be an up close and personal chat with some of the doctors and leading professionals in the women's health segment. And we also have an opportunity for you to participate because I'll be asking you questions as well. So, ladies, I wanted to share with you another thing as well. You'll be pleased to know that MIMIT Health is here to serve you in every way possible. Please take a listen.
Welcome to MIMIT Health. We're one of the fastest growing physician groups and health system in the country, and we are here to serve you. We specialize in minimally invasive procedures, whether it's spine, arteries, veins, prostate, fibroids. We do a wide variety of things, but we're here to solve your problem for you. We have some of the most highly talented, qualified, humble people who are here to serve you. We believe in servant leadership and to care for.
We are ready and available to serve you now. Call 708-486-2600. Telehealth services are also available.
All right. See, MIMIT Health really puts the health care and the care back into healthcare. So we're going to get started today as well. And I want to make sure that everybody is comfortable and everybody is okay. So before we get started, I want to just ask my first questions. Ladies, if you would just enter your age and in the polling section on your screen, that would be very helpful. Very good. While we're doing that, we want to just make sure that everybody understands. If you just can tell us what your age, that would be great. I see you guys are doing it now. To get started, we are going to hear from someone who may have been just like you. She's our patient advocate. Her name is Tommy, and she's had so many issues and problems, and she talks about them. But most importantly, she talks about how she got help and how she's living fibroid free. Take a listen.
My name is Tommy. I'm a registered nurse. I work in the hospital. I've had an experience of fibroids for a couple of years. So during the course of the fibroids, when I was having it, I will be having like a shortness of breath because my stomach is like up into my epigastric area, and each time when I eat, I'll be having nausea. Sometimes I even vomit. So it's kind of very frustrating thing for me. So when I discussed with one of my friends, he introduced me to Dr. Chopra. So the date was set for UFE. Afterwards, after 2 to 3 months, I started having a little bit relief. Like I'm not going to the bathroom anymore. Not frequently like as it used to be. It's reduced from the preparation room to where the procedure. The whole thing did not take more than 3 to 4 hours, and I was discharged home. No nausea, no vomiting, no bloating, nothing like that anymore. I'm free. So I would recommend it because it's not invasive, that somebody will be caught, that you will be nursing a wound for months, and at the same time, I've seen people going through those procedures like having a surgery that do not make it. I think this is a very good procedure for women that are having fibroids.
And ladies, I see that a lot of you are in that 40 to 50 age group. And so I am sure that many of you can really relate to Tommy and some of the experiences that she shared and some of the symptoms that she had. Now I would like to introduce to you Dr. Angela Walker. She's an OBGYN who is joining us today to talk about the important issue and how this issue has affected African American women. Dr. Walker?
Hey,
there you go.
hello
Yay!
everyone. Funny enough, with your poll, I am too in my 40s and almost 50.
Okay.
So this is incredibly important to my age group and my patients. For your listeners out there, thank you for this opportunity.
Mhm.
My name is Angela Walker. I am a mother of two wonderful boys. I'm an active dater. I'm a best friend, and I happen to be a board certified obstetrician gynecologist practicing over 15 years. I've had the pleasure of training many residents, medical students, NPs, PAs, and nursing students who have gone on to do incredible things, and I'm very proud of them. If anyone's listening, shout out to them. I've also had an opportunity to be mentored by several amazing people, just, to name a few: Cheryl Gibson, who's the Michigan Medical Society president and was recognized by our lovely new vice president, Ms. Harris, Vice President Harris. Mary Palmore, who is a obstetrician gynecologist practicing here in the Chicago area and has chaired many OB units in different hospitals. Um, Parents. My dad was an Anglican bishop, and my mom was, well, it still is, the best second grade teacher on earth. Where my dad was a bishop, my mom smoked Newports in the back of the church. So I
Oh boy.
had an opportunity to experience both, dignitaries and Ruby on the corner. And what I find is that we all kind of have the same dilemmas when we consider fibroids. And, when I turned 40, maybe 10 years ago, maybe, or 9 to 10 years ago, the only treatment option that we had was it's time for your hysterectomy. And, just looking at the ramifications of the scar tissue, the pseudomenopause, for our younger patients that also have fibroids, we'd offer them myomectomies for fertility. And once we did it, we could only offer them C-sections. So I was excited to learn of different options, just beyond the traditional two that most people are, familiar with. And so nowadays, I can offer, naturally the Dapolupron. And if you're over 50, you've probably been introduced to that to shrink your fibroids, but you can only use it for a short period of time. A lot of times it's only 6 to 9 months. There's osteopenia associated with it. And so, while it is a excellent drug, there are some side effects. So when I was introduced or started to consider outside the box options, uterine artery ablation or uterine fibro embolization became a viable option for most of my patients. I liked it because, I see my patients in Walmart or Neiman Marcus, depending on what my money looks like. And once they have experienced it, they give me all this praise like, oh, I feel wonderful. It was really quick. The recovery was great. And so I love to introduce my patients to this procedure. And if you think about it, right now, it is one of the better procedures in light of the nosocomial infections that are out there. And when I say that, I mean, we used to be worried about MRSA and C. diff, but now COVID has kind of changed the way that we practice. And so this procedure where people will usually look to do the myomectomies or the hysterectomies, which required you to stay in the hospital for long periods of time and be exposed to those different infections, provides an outpatient procedure. A lot of these procedures can be done in a surgical center, or a really quick hospital visit, which usually is outpatient, which decreases your exposure. So it's idea in this new normal that we're dealing with. Again, I see great results from my patients. The team at MIMIT are really good to take care of from Medicaid to, PPO or HMOs. They make themselves accessible to all, walks of life. And so I have really nothing but good things to say in this regard. And, I'm so happy that I have this option for my patients. Okay, that was a lot.
No, that was perfect. That's exactly what we needed to hear. And we thank you so much for your insight. Dr. Walker, are you going to be sticking around for a little bit?
I'm going to try. I have two patients that I was just on the phone with who are feeling pushy. And
Okay.
so I have to kind of keep my ear to the ground. As you see, I'm still at work,
I
get
do
no
see,
lunch,
but
no
not a
nothing.
problem at all. We thank you so much for your insight and we appreciate you for coming on with us, okay?
Thank you, and please just make me accessible to your audience. I'm happy to answer any questions, give my expertise, help them with referrals, whatever they need. I'm happy to be of service.
We appreciate you so very much. Thanks again.
All right, take care.
All right, bye-bye now.
Bye bye.
And speaking of questions, ladies, don't forget we will have a Q&A section at the end. So if you have questions, you can always put them in, even right now, into the questions section, and we'll be able to answer those questions. I'll submit them to the doctor, and you'll be able to get your questions answered. And speaking of the doctor, ladies, I would now like to introduce you to Dr. Samir Ahmed. He is the vascular and interventional radiologist with MIMIT Health. Dr. Ahmed, how are you today? And thank you for speaking to us about this very important subject and sharing the information to help us understand and to actually help the ladies get better. How are you today?
I'm good, Sandra. How are you? Thanks for having me on this panel.
I am very well. And we appreciate you so much because women are suffering and they need to know what their options are and how to get things taken care of. And we are just so appreciative to have you here today. Again, ladies, don't forget, if you have questions, you can always put those questions into the Q&A section and we'll be able to answer those questions at the end. So Dr. Ahmed, you ready? Let's get started.
Absolutely.
All right. So, Dr. Ahmed, what are uterine fibroids and are there different types of fibroids?
Sure, Sandra. So I'll start with sharing my screen just to make this a little bit easier. Can you see this?
Yes, we can.
Okay, perfect. So before we can talk about uterine fibroids, let's start by talking about the normal uterus. So women are the centerpin of our universe, and the uterus is the garden of life. That's where the child grows. So every month, the uterus basically prepares for childbirth, and in order to accommodate for the child, the uterus actually has to expand. So in order to expand, the uterus has these muscles that grow in order to accommodate an entire baby inside the uterus. And if the egg gets fertilized, the baby will grow inside the uterus. But if the egg does not get fertilized, then menstruation happens and the uterus cleans itself and clears itself out, as you can see in this picture. Now, what can happen is that these muscle fibers that have to expand in order to accommodate a child, these fibers can essentially become, I would say, either they can become disfigured, or you can say that there's some abnormal growths that can occur within the fibers. And these abnormal growths are called uterine fibroids. These are non-cancerous growths, or you can say quote unquote tumors, but they're not cancer. They're essentially these balls of tissue that grow inside the muscle fibers of the uterus. And they look like these essentially balls of soft tissue. This is a pathological example of, or pathology example where these fibroids have been cut out, and you can see that they essentially look like misshapen balls that have grown inside the uterus. And they tend to grow within the muscle, like I said, but they can grow also in different locations within the uterus. So some can be right in the meat of the uterus, which are intramural fibroids. Some can grow within the endometrial cavity. So this is the cavity where a child would be if a baby was inside the uterus. Some can have some outgrowth. They can grow a little bit protruding out of the uterine wall, and some can be somewhere in the middle. And it's also important to note that these uterine fibroids are very vascular structures. So a lot of the symptoms that women feel with fibroids, they occur because of not only their size, but also their vascularity. Here, this again, this is kind of reiterates what we saw on the other slide. Again, these are benign tumors, meaning that they're not cancer, but they're just growths within the uterus. They can distort the uterus because of their size. They can be single or multiple, and they occur in different locations within the uterus. And again, this is a little bit of a larger picture showing you what a fibroid looks like.
Okay. Now, Doctor, we often get the question, what causes fibroids?
So Sandra, that's an excellent question. And I think it's been researched a lot. Obviously, this is a very common problem throughout the world. And it's been researched a lot, but there isn't a clear answer on what causes uterine fibroids. It usually has nothing to do with, the lifestyle of a woman. It tends to be more genetic. So it tends to occur in families. So a grandmother will have it, or the mother will have it, their child will have it, their daughter will have it. And it tends to be clustered in families. So there's a very large genetic component to it. It's not very clear if there's certain type of foods or certain type of chemicals that we're exposed to just in our daily life that may be leading to fibroids. But what is very clear that there's a very strong genetic component to it.
Okay, great. So how are uterine fibroids diagnosed?
So the most common way so again, uterine fibroids are very common. So almost 80% of women of childbearing age will have uterine fibroids. And it's even more common in African-American women. Up to 90% or more of African-American women will have uterine fibroids. The vast majority of uterine fibroids are asymptomatic, meaning a woman with fibroids will not know that it exists, or the symptoms may be subtle, etc. But a lot of women will also experience common symptoms such as bleeding, pain, increased urination, etc., which we can talk a little bit more. But with these symptoms, women will go to their gynecologist, and a good gynecologist like Dr. Walker, I've known Dr. Walker for quite some time now, and she's an excellent gynecologist. And she's also very good at diagnosing uterine fibroids because she understands, the symptoms that are associated with it. So
we've already got a couple of questions asking for her information because the lady's already saying, I think she's great.
She really is. I've known her for a long time, and she's really a wonderful human being and a great person to work with. So, you need someone to recognize the symptoms that are associated with uterine fibroids, like, a gynecologist like Dr. Walker. And then the next step is to do an imaging study. So the most common imaging study ordered to evaluate for uterine fibroids is an ultrasound. Just like the ultrasound women get when they're pregnant, it's a very similar type of ultrasound that they get to evaluate for uterine fibroids. And ultrasound is actually a very good study to visualize uterine fibroids and be able to measure them and also locate them within the uterus.
Thank you so much for that. Now, also, we talked about the symptoms and you talked about them being common. So how are uterine fibroids treated? And what are the various different options?
Sure. So actually, before I move on to that, let me just touch little bit more on the symptoms.
Okay, great.
Again, so bleeding. So the most common symptom associated with uterine fibroids is bleeding. I've had patients who have bled so much that they actually became anemic, and that's a very difficult situation. There are women out there who bleed, 3 weeks out of the month, and those are the women that tend to, have a little bit more tendency to become anemic because they're bleeding so often. So bleeding, because the uterine fibroids are so vascular, that's actually the most common symptom. And again, there are the other symptoms that are associated with uterine fibroids are related to, for example, their size. So those are called quote unquote bulk symptoms. So patients can have pelvic pain, discomfort. The fibroids can press against the bowel or the bladder, causing frequent urination or constipation. There's also, some uterine fibroids can get very large. I've seen fibroids that are 15, 20 centimeters, and it actually feels like or looks like the woman is pregnant because it's protruding out and causing, that much what we call like bulk symptoms or mass effect. And then some women, they're diagnosed with uterine fibroids because they're trying to get pregnant and they're not successful or they're having difficulty, and they go to see their gynecologist and they find out that the reason that they're having these fertility issues is because of uterine fibroids. So again, these are the most common symptoms that women usually present with. And the treatment options are basically a spectrum, I would say. So this slide actually lays out that spectrum from the least invasive to the most invasive options. Starting from the left, you can see that some people believe that there's certain types of diets or foods that you can eat to treat uterine fibroids. And unfortunately, that data just has not panned out. So there has been a lot of studies done on trying to figure out if there are certain types of diet that can help with uterine fibroids, and it's just not very clear, and the data is just not very convincing. Another option is hormonal. So this is something that Dr. Walker touched on briefly. She mentioned Depo or Lupron. So this is essentially a medical way to induce menopause. So that changes your hormonal levels, and that can also lead to shrinking of the fibroids. But again, like Dr. Walker was saying, it is a dramatic change because you're taking a medicine that's essentially inducing menopause. And it's also, you can't take it forever. You can only take it for a certain period of time, and it also has some of the side effects that she mentioned, like osteoporosis. On the other side of the spectrum, you have some of these surgical options, such as open or laparoscopic hysterectomy, which is taking out the entire uterus, as well as laparoscopic, open, and hysteroscopic myomectomy. Myomectomy essentially means that you're going in and shaving out some of the fibroids that you can easily target. The challenging thing about myomectomy is that, you can't target all the fibroids. If there are multiple, you can only target some of them. And again, like Dr. Walker mentioned, women who are trying to preserve their fertility, it also limits some of the options that they have when they are trying to deliver the baby. For example, they might not be able to undergo a natural delivery and may need a hysterectomy. Most often will need a hysterectomy. Will most likely need a C-section. A hysterectomy is obviously taking out the entire uterus, and the fibroid embolization is a minimally invasive option where the goal is essentially to decrease the blood supply to the fibroid in order to shrink the fibroids.
Okay, well, very good. Now, what is the UFE treatment?
Sure. So let me show you another slide to demonstrate what the fibroembolization procedure looks like and how it compares to a hysterectomy.
Okay.
So hysterectomy, again, is an open surgery. versus uterine fibroembolization, which is a minimally invasive procedure done through the wrist artery.
Through the
And the
wrist?
patient, yes, so we actually go in through an artery that is in your wrist. So if you take out your hand and you feel your pulse, that pulse is the radial artery. And we actually go in through, make a little tiny, tiny incision about the size of the tip of a pen, something you could just put a Band-Aid over at the end. And through that little tiny incision, we go into the artery and go all the way down into the uterine arteries, which are the main supply to the fibroids. And we stop the blood flow to the fibroids and essentially, cut the blood flow off, and they immediately start to shrink. We can take fibroids that are literally the size of like a cantaloupe, or multiple 15, 20 centimeter large fibroids, and shrink them down to the size of a pea by cutting off their blood supply. So a hysterectomy.
Wow. From a cantaloupe to a pea?
Yeah, exactly. And so a hysterectomy involves a big abdominal incision. It's costly, it's painful, and it's more expensive. And when I say expensive, I don't just mean, the dollars and cents. It's also, it takes a high toll on a woman's body. Yeah. It's a open procedure, requires a long hospitalization, usually 4 to 5 days. There are higher risk of complications such as bleeding, infection, damage to adjacent structures. So the uterus, where it's located in the pelvis, is very precious territory. And when I say precious, I mean there are multiple important vessels, nerves, and other structures that are right adjacent to the uterus. One of the most important structures that is at risk for getting damaged during a hysterectomy is called the ureter. So the ureter is the connection between the kidney and the bladder, and it runs right along the side of the uterus. So you can imagine that this delicate small structure can very easily get damaged with a hysterectomy. And unfortunately, and I've seen this happen multiple times, women can end up essentially not being able to pee normally, and they end up with a tube coming out of their kidney and coming out of their back. That's the only way they can urinate. So just
That's
to
terrifying.
Illustrate, it is, and it's life-changing, unfortunately. As opposed to uterine fibroembolization, it's easier, it's better, it's faster, and it's certainly a lot less costly because it's an outpatient procedure, there's no, inpatient hospitalization, etc.
That was my next question. What should the ladies expect in getting a UFE?
Excellent question. So I want to kind of make a point by just showing you pictures what to expect. So when you're getting a hysterectomy done, this is the expectation that a woman should have. So it's a big abdominal incision, and here you can see the uterus, and these ball-like protrusions, these are the fibroids. You can see one here, maybe another smaller one over here. And at the end of the procedure, you have a large incision. As opposed to a fibroid embolization, the expectation is that the entire procedure is done through the wrist, and we use our image guidance, our special X-ray equipment, to look at all of our tools within the body that we're using to get into the blood supply of the fibroids and cutting off that blood supply. So here is a picture of this is an MRI showing a large fibroid in the uterus. And just to orient you a little bit here, so this is the spine, and this is the front of the patient, this is the back of this patient, and here is the large fibroid within the uterus. And once the blood supply is cut off, the fibroid shrinks down to essentially, something that's not even visible. And the uterus is back to its normal size and its normal shape. So let me show you one more picture here. Let's see if I can advance this slide to give you another. So this is another picture that answers your question, Sandra. So your question was what to expect.
Yep.
This is what you should be expecting. This is your wrist. and this little tiny hole in the wrist that we make to go into the radial artery, that is what you're left with. This band right here, this is a very special band that after the procedure, we inflate this band, and essentially it's a little tiny balloon that puts a little bit of pressure on the wrist to prevent any type of bleeding. And within 30 minutes after the procedure, this band is off, and our patients are able to walk around. They're back to essentially their normal self, eating, drinking, going to the bathroom. And they can even go to the bathroom or walk around with this wristband on. So this is essentially what you should expect if you're having the fibroid embolization done. This is it. This is pretty much the entirety of the procedure that you'll see, this little wristband and this little incision.
That's a huge difference from the hysterectomy picture you just showed to this one.
Exactly. And again, another thing is that it's a outpatient procedure. What I tell my patients is if you're coming in at 8 a.m. to have the procedure done, you're eating lunch at home. You're home by noon.
Wow.
The entire procedure usually takes somewhere on the order of 30 minutes to 45 minutes to an hour. Usually very, very rarely more than an hour. And the recovery, again, is very short. Within 30 minutes, you're back to your normal self.
And wonderful. And how long before they have to go back? They can go back to work, or is this, they can go back the next day, or how does that work?
So that's an excellent question, Sandra. So it varies a little bit patient to patient. What I tell patients is expect to have some pain after the procedure. We'll give you excellent pain medication and a regimen to help control that pain. And for the most part, most women are back to their normal selves within 2 to 3 days. I do tell patients that sometimes it's better to have the procedure done on a Friday, so that maybe you're basically ready to go back to work on Monday. But I've had patients who have had the procedure done in the morning one day, and the next day they're back to work. So it just varies from patient to patient. You know, people who have a little bit of a higher tolerance for pain are able to get back into the swing of things quicker. And others who have maybe a little bit lower threshold for pain, for them it might take 2 to 3 days. But again, nothing like a hysterectomy where people can be out for weeks.
Right. I know. I've known people who have had them, and it's 6 weeks home, 6 weeks at home. Oh, ladies, and by the way, I want to make sure that you guys know that you can pop in your questions in the Q&A section, and we'll be presenting those questions to Dr. Ahmed shortly. So Dr. Ahmed, any additional information you want to share with the ladies before we go to their questions?
Sure. Let's see if we can go through these slides a little bit. So, you know, for me, one of the most important things when it comes to personal health is education. So for me, I think it's an honor to be here because this is an educational seminar, and we're trying to educate women on what are some of the options out there. So uterine fibroembolization is a very well-established procedure, and it's been around for a very long time. But unfortunately, even in 2020, the information out there is very limited, and a lot of women will not be given this option because for one reason or another, maybe either their gynecologist is not aware of the procedure, or you know, maybe the area where they are, it's not available, etc. But even back in 2004, Condoleezza Rice had this procedure done, and now we're in 2020, and still there's a lot of women still getting hysterectomies. I just looked it up. I think there are 600,000 hysterectomies performed here in the U.S. And one third of women in the U.S. will end up with a hysterectomy by the age of 50. So you can imagine, one, how common fibroids and are in the population, and two, how many women are ending up with hysterectomies. And you can also imagine how many of those women are probably not even told about this option. So that, you know, education, again, from my perspective, the most important thing we're doing here today is about education. Whether you choose to have a hysterectomy, myomectomy, fibroembolization, the most important thing is that we are they know that this option is out there.
That it's available. When we have options and when we have choices, then hopefully and prayerfully we'll make better choices
Exactly.
as opposed to just having one option. So we do appreciate you. Anything else?
No, I think that was about it.
Okay.
Probably a good time for questions.
Very good. Well, we got plenty of them for you too. And ladies, don't forget you can still put those questions in, and we will get to your question as well. Okay, so here's our first one. I'm 45 years old and I've been diagnosed with 8 fibroids. They are small to medium, but one is the size of an orange. Will this fibroid continue to grow or will they begin to decrease with age?
So once you hit menopause, the hormones that cause fibroids to enlarge, those hormones dramatically decrease. So after menopause, the size of the fibroid will decrease over time. And the assumption is that as the fibroids decrease in size, the symptoms that you're having associated with fibroids, such as bleeding, pain, etc., will also improve. Now, the time frame for how long it takes the fibroids to shrink after menopause is not clear, and it varies, from one woman to another. But the fibroids, yes, as the hormone levels decrease, they should decrease in size as well over time after menopause.
Okay, so here's the second question, and I think we answered the first part, but they're asking, how long does the operation take, and are we under anesthesia?
So the operation itself, I don't even call it an operation. It's more of a procedure where a minimally invasive procedure. So it can take up to an hour, but on average, it's somewhere on the order of about 30 minutes to 40 minutes for a typical procedure. We don't give general anesthesia for the procedure because, again, patients are very comfortable. They don't feel any pain. We numb up the area where we're going in the wrist, but we also give what's called twilight sedation or moderate sedation, which is a combination of medications which basically makes you feel like you're getting a good night's sleep. So you won't be in any pain, you won't feel any discomfort, and you should be awake from those medications, that type of anesthesia, within 20 minutes after the procedure.
Wow, okay. So here's our next one. Can fibroids affect a woman's vascular circulation? And do fibroids increase the risk of developing varicose veins?
That is an excellent question. Fibroids, they are very vascular structures. If there's any type of abnormal circulation, meaning maybe there's some type of arterial venous fistulas where because of the abnormal growth of the arteries, maybe there's a little bit more connection to the veins as well. I can imagine that that does create some abnormal circulation within your body, especially if the fibroids are large, especially if the uterus is large. And in that sense, there is an abnormal circulation that's created. Now, fibroids that are large can also have a mass effect, can actually press down on veins that are draining the legs. Okay, so you can imagine that there are these large veins that have to get the blood out of your legs and your feet, and they're all draining through the pelvis, and they're making their way back to allowing the blood to go back to the heart. Now, if there are large fibroids that are pressing down on those veins, they can certainly cause varicose veins as well. So because they're pressing down on the veins, they're preventing the blood from getting out of the legs and going back from the heart. And therefore, the only direction the blood can go is back down into the legs and create increased pressure. And that increased pressure translates into essentially varicose veins.
Wow. Never knew that was associated with it. Thank you, Dr. Ahmed. Okay, so now this is more of a statement, but I'm going to give it because It's important. We have she said, my cousin died of a hysterectomy and no one knew that it was so risky. This is unbelievable. Why aren't doctors telling us about this?
Right. First, I'm really sorry about that. It's a tough situation when physicians are not completely open and honest about the risks associated with their procedure, especially a procedure of the magnitude of a hysterectomy, where there's a fairly significant chance of heavy bleeding, damage to adjacent structures, infection, etc.
Okay.
I don't have a good explanation for why the information is not out there about uterine fibroid embolization. What I can say is that uterine fibroid embolization has the highest level of designation by the American College of American College of Gynecology. So the
Okay.
American College of Gynecology has given uterine fibroid embolization their level 1 designation, which means it is considered first-line treatment along with hysterectomy. Of course, we talked about the differences between a minimally invasive procedure and an open procedure, but they have that same level of designation. So I do wish, that more information is out there on fibroid embolization, and people understand, what type of risks they're taking when they're undergoing a fibroid embolization versus a hysterectomy or myomectomy. And I'm sorry to hear about your loss. That is
Absolutely, we're sorry, but we're so happy that you're here with us today, and all the women are here with us today to find out that information. Because as the old saying goes, if we knew better, we'd do better, right?
Right.
Okay,
Exactly.
all right. Here's our next question. Now, what are the side effects and the actual downtime? I know you talked about that after the procedure. Is it true you will lose belly fat after this procedure is done? And lastly, she said she takes care of her mom and she wants to know how would that affect her in terms of being able to take care of a bedridden mother after the procedure.
Sure, that's an excellent question. So one of the most, from what I find, talking to women about fibroid embolization and uterine fibroids in general, one of the most common reasons that the symptoms for uterine fibroids are ignored or set aside is because women are really busy. They have to take care of the household, they have to take care of kids, they have to take care of, their husband, etc. They're working, they might be working multiple jobs, and the amount of downtime that's associated with the option that they're given, like a hysterectomy, is just too much to take on, and therefore those symptoms get ignored, the fibroids get larger, etc. So the great thing about uterine fibroid embolization, I think one of the best aspects of the procedure is the recovery from the procedure. So it's a very short recovery. What I tell my patients is that what you should expect is for the first 2 to 3 days after the procedure, the pain may it may increase a little bit. And that pain is very well controlled with the medications that we give, which is a combination of an NSAID and also a pain medication that helps control the pain. Usually after that 2 to 3 day mark, patients start to feel significantly better. And I would say 95 to 99% of patients that I treat, by day 4, day 5 after the procedure, they're essentially back to their normal selves. So they're back to work, they're back to all of their normal exercise, activity, activity with the kids, their parents, etc. So my expectation is that somewhere between 2 to 5 days is going to be your window of recovery. And after that window, you're going to be back to your normal activities.
Okay. Now, what about that belly fat question? She asked, does this help reduce belly fat too?
So that's a really important question.
I think everybody's ears perked up on that one.
So large fibroids, like I was saying before, large fibroids give the appearance of belly fat, because essentially these are large masses, they're in the uterus, the uterus is sitting, right underneath the skin, and that mass effect, the mass for the bulkiness of the fibroids, when you look when you look from the outside, it looks like it's belly fat. It looks like, some women actually look like they're pregnant.
Yeah.
And the way that a lot of gynecologists and, myself as well will describe the size is actually by saying what term you would be if you were pregnant. Like, this is a 4-week belly, or this is a 6-week or
Wow.
8-week, pregnant appearance. So after uterine fibroembolization, that size, the belly appearance that's related to the size, that will significantly improve. So you can imagine something that's the size of a cantaloupe going to the size of a pea, and how that appears from the outside.
So
You're
it
going
makes your
to notice a big difference.
right.
In
So
the
it makes
size.
your belly go down. It makes it look flatter. So not so
Exactly.
much removing the fat, but removing the fibroid can make it look smaller.
Right. Exactly.
Okay. Okay. Very good. Now here's another question. The embolization may freeze and shrink the fibroids, but how would women find out if they have endometriosis as well?
And endometriosis is a separate diagnosis. So
Okay.
endometriosis, I don't want to get into the details of it, but essentially endometriosis, to put it very simply, is an abnormal implantation of endometrial tissue. So the endometrial lining is the inner lining of the uterus, okay?
Okay.
When that tissue, the inner lining of the tissue, ends up somewhere else, could be in a separate part of the uterus, it could be outside the uterus, it could be near the ovary, that tissue, when a woman goes through the monthly cycle, just like the endometrial tissue will enlarge, will bleed, will, that other ectopic tissue, what they call ectopic tissue, meaning it's located somewhere beside its normal location, that will also undergo the cycle. And that can also be associated with significant pain, bleeding, etc. So that is a completely separate diagnosis. That is not something that we're treating with uterine fibroembolization, but that is also something that can be diagnosed with imaging, just like an ultrasound, for example.
Okay. So now here's a good question. Is it possible that a woman would not be a candidate for a UFE?
That's an excellent question. And there are very, very few women that fall into that category. The vast majority of women that I see with uterine fibroids, I would say over 95, 98% of women are good candidates for the procedure. Now, that very small subset of women that may not be a good candidate for the procedure, those women may have a fibroid that is protruding out of the uterus, but it's protruding, not only is it protruding out, but it's protruding out with a very small stalk, okay? Almost like, you can think of it as a golf ball on a tee. So that stalk is protruding, that tee is protruding out of the uterus, and there's a large fibroid on the end of it. Some of those women may not be a good candidate for the surgery, because our fear is that when we cut off the blood supply to that fibroid, it can fall into a place that we don't like, for example, like into the pelvis. But we're talking about such a small fraction of patients there, about 1% or less, that I would say the vast majority of patients are good candidates for this procedure. Anything that would make you a difficult candidate for a large surgery, for example, patients who have trouble breathing, or patients who, for one reason or another, are not good candidates for the general anesthesia that's required for hysterectomy. All of those patients are great candidates for the fibroembolization, because you don't have general anesthesia. You don't have to worry about a large, long, prolonged surgery. To give you a short answer, essentially, very small, less than 1% of women may not be good candidates for fibroid embolization, but the vast majority are going to be.
Okay, so now here's another question. This young lady said she had, and I say young lady, she had a UFE in 2008. And the fibroid shrunk, but she still experiences pelvic pressure. She's now 55 and postmenopausal.
Okay.
Is a hysterectomy her only option, or can she repeat the UFE?
So that's an excellent question too. So you can repeat the uterine fibroid embolization procedure. What can happen is she had the procedure done in 2008, correct? And over time, so essentially in 2008, whatever uterine fibroids she had, when she had the embolization procedure done, all of those fibroids, the blood supply was cut off, they shrunk down, her symptoms improved. But over time, you know, maybe some small fibroids may have come about in a different location. So the ones that you kill off, they're gone and they're gone forever. Those don't come back. But there is a small possibility that a fibroid appears in a completely different location with a different new blood supply. So in order to treat those patients, you can actually repeat the fibroid embolization procedure, go in and just cut off the blood supply to that fibroid and allow it to shrink down just like it had done previously with the other fibroids. What I would advise is, one, she should get an ultrasound and a full evaluation to make sure that the symptoms that she's having post-menopause, once she's got, now that she's post-menopausal, that they are related to the fibroids. Because one thing to be, very careful with is patient selection. So we want to do what I always strongly advise, especially for postmenopausal women, is have an evaluation by your gynecologist. Have a full understanding of what's going on and what's causing the symptoms. Don't just assume that this is related to fibroids. Make sure that it's not anything else. And once we've determined that yes, your symptoms are due to uterine fibroids, that's when the fibroid embolization procedure comes in, and we can, help by shrinking those fibroids. But it is very important to have a proper diagnosis, to have a proper evaluation, and we obviously help in that process and help in every step along the way.
Okay. Well, here's the $1 million question. The ladies are asking, do you take insurance? What types of insurance will cover this? And what's the approximate cost of this kind of a procedure? It sounds expensive, they're saying.
So the one thing that I'll say a couple of things on this topic. So one, I'm not an expert on insurances. But what I can say is that MIMIT Health has always been an organization that treats all patients. So whether you have like Dr. Walker, and we worked with Dr. Walker for a very long time, and she spoke to this very well. She said that, whether you have Medicaid or you have a private insurance or you have Medicare, what have you, we treat all patients. And that just goes back to the principle of what we do as an organization, what we believe in. So our goal is to open doors, open possibilities, and figure out a way, how can we treat our patients, no matter what type of insurance they have. The actual cost of the procedure, I don't know, because the vast majority of insurances cover it. So it's very, very little out-of-pocket expenses, whatever your deductible is, for example. So the out-of-pocket expenses are very low. But what insurance actually pays out, I don't know off the top of my head. But what I can say is that the best approach is to come in for a visit with us, figure out if this is the right procedure for you, and then let us help you figure out, how to make this work. And we work very closely with patients. Sometimes, I mean, there are patients that that will come back to us and tell us, I went to so-and-so doctor and they denied me for this reason or that reason. And, we take great pride in making sure that we take care of all patients.
Okay. Well, very good. And we got a lot of questions. The ladies are very active today. Okay. So here's another one. She says she has high blood pressure and diabetes. What are the risks to her and side effects?
High blood pressure and diabetes, very low. Okay, so that's an excellent question because it alludes again to the type of procedure that you're having done. This is not a large surgery. This does not involve a large hospitalization. It's a minimally invasive outpatient procedure that is very, very low when it comes to risk. So the number that I quote, some of the numbers that I quote are less than 1%. This is based on, a lot of literature. Again, like I said, there's level 1 evidence for this procedure, meaning multiple clinical trials have occurred. So the data out there is very good on this procedure. In the literature, less than 1% chance of any type of major complications such as bleeding or infection, and 98% success rate in improving and getting rid of the symptoms that are associated with uterine fibroids. To answer her question, it would be a very safe procedure and probably the safest procedure she can have to treat uterine fibroids.
Perfect. So here's another. Is it possible for fibroids to cause blood clots in your body?
To cause uterine fibroids to cause blood clots in your body. So this kind of goes back to another question that we had related to circulation and what uterine fibroids can do in terms of creating abnormal circulation. So one of the main type of clots that can develop in the body are called DVTs, deep venous thrombosis, and they most commonly occur in your legs. Now, if you have very large fibroids that are pressing on the veins that are draining your legs and prevent the blood flow from getting out of your legs back to your heart, that venous blood flow that gets stuck in the legs, that or slows down in the leg, that can form into a clot, and that can form what's called a DVT. So yes, if the fibroids are large, they are pressing down on your veins, they can cause clots in the legs.
Okay, so now we're going to combine a couple of these so we can get everybody's last couple of questions in. And
Sure.
this one is more, there's a young lady, she said she was told she had fibroids, but now every month she's nauseated, she gets diarrhea, she's physically sick, vomiting, and is all of this being caused by the fibroids? They put her on Lupron to reduce the fibroids, but she's thinking that this may be a better option. Another young lady is saying that she gets a hard lump around her navel when it's close to her menstrual, and they were told she had fibroids as well, and she's just trying to see, is this related to the fibroids?
So, some of these questions are would require further evaluation. So you'd have to come into clinic. I would have to do a full history, physical, and get a much better understanding of the timing of the symptoms, how often they happen, how long they last, etc. And actually feel to see, if I can feel the fibroids, because a lot of the times they're so large that I can feel them just with my physical exam. What I can say is that a lot of these symptoms that are being described of nausea, of sometimes, abnormal bowel movements, etc., they can be related to fibroids. And that's because of, the fibroids pressing on the bowels. So you can for example, I think one symptom that you mentioned was loose stools or diarrhea.
Right.
Is that right? So now you can imagine a scenario where a patient who has a large fibroid is pressing up against the bowel, and depending on where it's pressing, sometimes the stool is getting stuck, and when it really builds up, the constipation builds the movement of the colon, essentially, you know, the function of the colon is altered, you can have bouts of constipation, you can have bouts of loose stools. So yes, you know, that's how your bowel movements can become altered just because of the fibroids. Fibroids can also, you know, they can, as they're exposed to different levels of hormones, there also can increase or decrease in size a bit. So maybe sometimes when you're at a certain point in your cycle, you feel it more, just because of all the other changes that are happening with your uterus. Those changes are also happening with your fibroids. So yes, to make it a shorter answer, a lot of those symptoms that you are describing can be associated with fibroids. But again, you know, it's always very hard to make these calls just by listening to someone. You really have to do a full physical exam, spend a lot of time with them to understand, you know, what's going on.
Okay, and our final question, and ladies, I know we have a lot and people are waiting and asking for how can they get an appointment. That slide is coming up, and if they can put that slide up right now while we're asking the questions, that'll be great, because people are definitely asking how do we get our next appointment. But here's our final question. With everything happening with COVID, how safe is it to come into your facility?
That's an excellent question. So, you know, right now, going to the hospital is a big deal. So let's say if you were going to have a procedure done at the hospital, like a hysterectomy or myomectomy, it's a big deal. You know, you're being exposed to a lot of different bugs that are there, such as COVID, but also other bugs such as MRSA. All of our procedures are done on an outpatient basis. They're done at our outpatient vascular centers, which are COVID safe. And we have in-house testing to make sure that everyone that's there is COVID negative, and that testing is regular, as well as you know, all the precautions and guidelines that we've put in place. You know, at MIMIT, we take great pride in saying that the guidelines and the precautions that we've taken on and put in place are on par with the, you know, the large academic centers, et cetera, because that is the most important thing to us, to keep our patients and our staff as safe as possible. And, you know, from my perspective, I think, you know, given everything that's going on with COVID, we are a very good option in terms of going to a place where you want to be safe from COVID.
Absolutely. Well, thank you so very much. And ladies, before we go, we're going to have a quick survey that we'd like for you to take. So please don't punch out right now. We want to make sure that everybody is on and have an opportunity to do that. And the slide is coming up with the information. Of course, you can always go to MIMIT Health. That's MIMIT, MIMIT health.com. You can always log on there and find your information as well. So again, we thank you so much, Dr. Ahmed. You have answered every question, and you've been a trooper because the ladies had 26 questions today.
Thank you, Sandra. I really appreciate it.
We've had quite a bit of questions, and they're still coming in. But we're going to have to wrap this up, and we do appreciate this. Oh, we even got one that says you're attractive, that they like you.
Thank you, Sandra. And the one thing that I'll add is, because we were talking about MIMIThealth.com, I do encourage everyone to go to MIMIThealth.com. We have, it's a great website that shows, you know, all of our locations, and also a lot of patient testimonials and a lot of information about other work that we do, including treating uterine fibroids. It gives a lot of information on our physicians, and there's actually a portal, I believe, on the website that allows you to put in questions or request an appointment. So I really encourage everyone to take some time, take a few minutes, go to MIMIThealth.com, and you know, we look forward to seeing you.
All right, that's MIMIT health.com. That's MIMIThealth.com. log on today and you can put in for your appointment and find out more information. But what we don't want you to do is just sit on this information. We want everybody to understand and recognize that you can start 2021 off fibroid free. So let's start off fibroid free by, and that's a tongue twister, fibroid free by logging on to MIMIT Health. That's MIMIT Health.com. I believe I just saw that slide. They took it down, but that's going to give you the phone number as well. And don't forget, like, there it goes. It's 708-486-2600. That's 708-486-2600. And you can, again, MIMITHealth.com. We want you to call or log on and make your appointment today. And you can start off 2021 fibroid free. That's amazing. So again, we thank you. So that completes everything for us today. We hope that this has been helpful for you. Dr. Ahmed, you've been a trooper. We really appreciate you. You gave us some vitally important information, and I think that the ladies will be able to make some decisions, some educated decisions now, just by hearing your information on today. We appreciate you.
Thank you. Thank you for having me.
You're more than welcome. And also, ladies, don't forget, we do have our survey that we would like for you to take. We appreciate you, and thank you for joining us, and you have a wonderful evening. God bless you.